October is Breast Cancer Awareness Month, and with the recent announcement of Florida First Lady Casey DeSantis' breast cancer diagnosis, it's something that's top of mind for many women right now.
And many put off crucial tests like mammograms because of the pandemic, but that can be a big issue when it comes to tracking the potential for breast cancer because early detection and stopping in early stages is key.
So what are the stages and what do they even mean? Morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, it seems like everybody knows someone who has been diagnosed with breast cancer. According to the American Cancer Society, more than 200,000 diagnoses of breast cancer happen every single year. And for those who get the diagnosis, there are a lot of words that get thrown around. It can make it an already stressful situation even more confusing. So with me now is Orlando Health oncologist, Dr. Nikita Shah. Thank you so much for taking time out of your day. So let's talk about those words that people tend to hear when they get a breast cancer diagnosis. What are some of those words?
So the first word is cancer, right? That people always worry about. What does it mean? Am I going to die? So what we want to reassure people is that breast cancer, especially when caught early, is a very curable condition. Then we look at certain things on the cancer itself that tells us how we need to treat it. So we look at what's called prognostic markers, so the estrogen receptor, progesterone receptor, HER2/neu status, which helps determine what kind of treatment they are going to need and whether the treatment needs to be before surgery, after surgery, which helps determine is somebody going to need chemotherapy, are they going to need targeted therapy. And then we look at the stage of the cancer, meaning how big is the cancer? Is it in the lymph nodes or not? Has it spread anywhere else? And all of that is put together, obviously individualizing that for each patient to determine what the next best treatment is going to be for them.
I think one of the big misconceptions that a lot of women have is that if you don't feel it, you don't have it. We're used to the recommendation to do self-breast exams, but it's really important to go get these screenings done.
Absolutely, because by the time you feel it, it's probably about 2 centimeters in size, while a mammogram can pick up something that's half a centimeter. So you don't want to wait till you feel it. You want it to be caught early on that annual screening mammogram.
Now, treatment has changed over the years,
Yes.
and we were talking earlier about chemotherapy. Does every woman need chemotherapy who has breast cancer?
No. So there's a large number of patients, especially those with hormonally driven cancers, that may not need chemotherapy. We can now do genomic tests on the cancer cells itself, which tells us who are the patients who really benefit from chemotherapy, but more importantly, who are the ones where we can avoid chemotherapy.
And what are those treatments like if you don't need chemotherapy?
Most often is hormonally driven medications or pills that they would take for 5 to 10 years.
Wow, so just a pill?
Just a pill every day, yes.
Wow, and you've seen cancers completely go away because of that?
Absolutely. So the cancer is removed at the time of surgery, and then everything we do beyond that is preventive. So these medications help reduce the risk of the cancer coming back.
That's fantastic news to hear. And of course, a lot of people are talking about the governor's wife and her announcement and how in this case, you know, she was 41 years old, is 41 years old. And I know that there are women out there who are in their 20s, who are in their 30s who get this diagnosis. And so what do you say to somebody who is younger and they're asking for a mammogram before the recommendation? So
the recommendation is that if you're average risk person, then you start your screening mammograms at age 40. But if you have a higher risk, so family history, or if you've had abnormal biopsies before, we may start those mammograms sooner. But more importantly, if you feel something is not right, when you're checking yourself, you feel something, even if you're younger or even if you're older and you just had a normal mammogram, don't ignore it. Please seek attention.
What if you don't know your family history? Because I know that plays a huge role in making the determination to do an early screening.
So that's where genetic testing comes in, because we may want to have you meet with a genetic counselor. And if you don't know your family history, you're adopted or you don't have a relationship with the family, maybe that person needs to undergo genetic testing and then be followed in a high-risk clinic where they are monitored much more closely than somebody else their age who don't have a higher risk.
It's so important for people to hear that there are options and alternatives like genetic testing, so that if they are wondering about this, they can go and start to get results for their families.
Right,
and
being monitored closely by a healthcare provider.
Wonderful. What else do you want people to know during Breast Cancer Awareness Month? I know women are oftentimes neglecting their own health. I'm a mother of an 8-month-old, so I just know that feeling. What do you want to tell women during this month?
What we have seen a lot is that with the pandemic, a lot of women didn't go for their mammograms last year or even this year. Places are open, almost all places are open for screening mammograms. So if you haven't had a mammogram yet, please go get your mammogram. check yourself. If you feel something's not right, go see your doctor. Doctor's offices are open. If for whatever reason the doctor is not seeing patients in person, you can still do a virtual visit and do the next workup, but don't ignore it, because unfortunately, if it's a problem, it's not going to go away unless we address it.
All right, Dr. Shah, thank you so much for your time.
Thank you for having me.